Low progesterone can result from a couple of different things. It can be because you did not ovulate that month, or it could be because you have a short luteal phase, so a short second half of your period, and you just don't make quite enough progesterone. Now, some of the symptoms of low progesterone that we've talked about before are that you might have PMS. You could have fertile mucus during that premenstrual phase. Your periods are going to be heavier, more clots, more cramping. You're going to have low moods. And then what about how to measure progesterone? So it can be a little bit tricky, but it can be done with a blood test. And it needs to be done about in the middle of your luteal phase, so the middle of your second half of your cycle. So for a normal 28-day cycle, that's going to be about day 21. But if your periods are only 21-day cycles, that's going to be around day number 14. 35-day cycles, around day 28. You want it to be about 7 days after you ovulate and about 7 days before you start your period. That's your true luteal phase, or the mid-luteal phase. So you really can't interpret a progesterone level until you have your next period. Now, your provider may not know when to tell you to have your blood tested to get the optimal amount reading. And if in the mid-luteal phase, your progesterone level should be about 3 nanograms per ml, and optimally around 10. However, if you get a number that's lower than expected, it might just be because you didn't draw it right at your mid-luteal phase. The other reason that it can be way higher than 10 as well. Actually, the higher the better. And our progesterone varies in 90-minute cycles. So if it's on the low side of normal, that may just mean because you caught it at a lower time in that 90-minute cycle. Very, very complicated. Hormones are complicated. And so we just have to really track our periods. One of the most scientific ways to tell if you're ovulating and to tell what your progesterone level is to track your temperature. And so you want to see that little temperature rise and then continue that same level until you get your period. That tells you that you have ovulated and that your progesterone level is probably relatively good. And remember, your follicles, your eggs, live for 100 days. So you have to be healthy that whole 100 days that they are living in order to have a healthy period. So if you are not well for even a portion of that 100 days, it's going to affect your period. It's going to affect your progesterone level some months down the road.